Welcome to the Wow MD podcast, where in each episode, you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome back to continuing the discussion on IV vitamin therapy. In the last episode, I talked about B vitamins and how important B vitamins are. I went from B1 to B12. I talked a little bit about IV vitamin therapy in general. But in this episode, I want to continue the conversation about other vitamins that are available for intravenous administration, why they're good for us. And after I finish the discussion with the B vitamins, the vitamin C, calcium, and magnesium, which are minerals, essential minerals, I'm going to move on and talk about some ingredients that are not covered by the insurance company, guaranteed to not be covered, and what are they useful for. So give you a little bit of information. So when you choose a specific cocktail at your IV hydration spot, then you would know what to look for and ask for certain ingredients. And obviously, if you will have it in a doctor's office, it will be customized to your needs. But anyway, let's dive right in. And let's talk vitamin C. Vitamin C can be administered intravenously and very, very useful in this form. Now, why is vitamin C important? Well, everybody knows this, right? This is for children. Vitamin C boosts and supports a healthy immune system. So it's well known for its role in enhancing and strengthening our immune system. Why injectable? Well, injectable forms will provide a rapid increase in vitamin C levels. It's supporting immune function much more effectively in certain medical situations and conditions. Let me give you some examples. You're exhausted after a difficult, stressful experience, right? Somebody died, somebody had a hospitalization and surgery in your family. You are traveling to a faraway country that's known for its environmental dangers, and you risk exposure, right, to many infectious illnesses there. Or you're very prone to infections and have been exposed to someone sick, and you wish to avoid getting sick. These are all perfect examples of situations where you will need vitamin C. You will want that extra humph that you get from vitamin C that's injected either intravenously or IM, intramuscular, right? So you will seek the IV clinics or the doctor's office if this therapy is offered. However, consider the fact that vitamin C will not be covered for any of these circumstances. So in my next episode, come back, I'm talking about the uncomfortable topic of medical insurance for vitamins. But in this episode, I'm just focused on the benefits and the medical consequences, right? So everything that I talked about as why you would need that boost of vitamin C is great. And everybody knows you need vitamin C for these circumstances, but these are not something that will get covered by insurance. Number two, another big benefit of vitamin C, it's a very powerful antioxidant. As you know, vitamin C helps neutralize free radicals in the body, which will help reduce our oxidative stress and prevent damage to our cells and tissues. Free radicals are unstable molecules that are made during normal cellular metabolism. Free radicals can build up in your cells, can cause damage to other molecules in the cell, DNA, lipids, which is the cellular membrane, and proteins, sometimes to the point of cellular death. So we don't want free radicals. We don't need free radicals. But guess what? We get them every day, 24 hours a day, every minute on the hour, every second of the day. So our body is built with this amazing ability to heal. It is also built with means to neutralize free radicals. So we need vitamin C and a variety of antioxidants. And guess what? Where do we get these antioxidants? Where do we get the vitamin C? The free radical quenchers, right? This little sponge that absorbs all the free radicals. We only get them from food. So yes, food can be medicine, dear listener. because of all these essential vitamins and minerals that our body cannot make on its own, and it needs to get from the environment in order to function and to function well. So please be aware that humans, unlike most animals, are unable to make vitamin C inside their bodies. So they need to get it from the diet. So it is an essential dietary component. It has to be part of our diet, right? So IV therapy helps enhance vitamin C absorption, especially for individuals who cannot adequately absorb the vitamin C through their digestive tract due to conditions like gastrointestinal disorders, right? Do you remember in the last episode, I talked about 2/3 of adults in the United States suffer from some digestive problem? Well, guess what? Injectable vitamin C ensures that they receive sufficient levels directly into the bloodstream, okay? Number 3 benefit for vitamin C, it supports wound healing. It's essential for collagen production, which is vital for our wound healing and to maintain healthy skin, cartilage, and bones. Vitamin C is great for a beauty IV. Well, guess what? Your insurance is not going to cover a beauty IV. They don't care about you being beautiful. They care about you not being super sick, right? Number 4, cancer therapy support. High-dose vitamin C injections, especially IV, are used as part of a complementary therapy for cancer patients. And some studies suggest it may also help alleviate their symptoms or enhance quality of life in these cancer patients, although obviously more research is needed. But some swear by it and some have not found it useful. Now, this could be a whole topic for a podcast of its own, but the truth of the matter is there's so many factors that influence cancer treatment that includes vitamin C. Like when you start the therapy, during the cancer diagnosis process. What type of cancer is it? How aggressive is the cancer? How healthy is the body when cancer is diagnosed? What is the ability to pay for vitamin C therapy? Cost can be dose dependent. And last but not least, what is the dose that is actually used? Because there's no clearly established or vetted and standardized protocol, more like some guidelines. Like start at 15 grams and then go up to 20 to 25. You might use up to 50. But it's very based on the personal experience of the clinic that you choose. Because high dose vitamin C, if you're not used to giving somebody over 10 to 15 grams and how to adjust the acidity and the pH of the solution and how to monitor for things and how to check their kidney and all these other things. Again, like I said, this could be a podcast episode of its own. You can get in trouble, right? As a physician, as a nurse. The patient can have a problem. So you need to know what you're doing. Number 5, vitamin C reduces fatigue. Many patients report feeling more energized and much less fatigued after vitamin C injections, which can be particularly beneficial for those with chronic fatigue syndrome and other debilitating conditions. Vitamin C, number 6, can help with allergies. It has anti-inflammatory properties, and increasing our vitamin C levels can help reduce the severity of allergy symptoms because it decreases the body's histamine response. Who doesn't know that vitamin C improves skin health? Although more commonly when applied topically, like you apply directly on the skin and your skin is going to look beautiful, right? However, systemic vitamin C orally, intravenously, or intramuscularly can contribute significantly to improve skin texture and elasticity because of its major role in the production of new collagen and remodeling of the existing collagen. So enough about vitamin C. It's amazing. It's very, very good. It's an essential vitamin that we can't live without. So we got to have it. What about calcium and magnesium? Well, calcium and magnesium are both vital minerals and nutrients that are essential to the human body. We cannot make them, so we have to introduce them in our diet through food. Now, there are very specific indications for calcium intravenously, like hypocalcemia. You have not enough calcium. That's a bad thing to have, right? Too much potassium, called hyperkalemia. You might need calcium intravenously, and that's actually standard of care during a blood transfusion. You might need calcium intravenously for electrolyte support for patients in critical care units or when someone is managing a cardiac arrest, because we want to resuscitate and bring back the muscle of the heart. Magnesium, on the other hand, other than being extremely important for bone health, blood sugar control, and influencing the release of various hormones, as well as the body's response to hormones, is widely known for a variety of critical key functions, like energy production within the cells, or how magnesium is vital for nerve transmission in the regulation of neurotransmitters. And magnesium helps regulate the process of muscle contraction and relaxation. And obviously, magnesium deficiency, everybody knows, can lead to muscle cramps and spasms and weakness. Magnesium contributes to the body's ability to act as a redox, or its capacity for antioxidation by quenching the free radicals, because it supports the function of glutathione, the most powerful antioxidant in the body. Last but not least, magnesium helps regulate our mood. It can help reduce stress, and magnesium deficiency has been involved in many conditions like anxiety and depression. From a medical standpoint, magnesium intravenously is used in emergency situations to correct low magnesium levels, especially if a patient comes in with severe nausea and vomiting and is known to have digestive malabsorption. IV magnesium can help stabilize a regular heartbeat and is used in treating some arrhythmias, and especially during heart attack treatments. IV magnesium can be used for asthma management when a patient has an acute asthma attack. Intravenous magnesium will help open up the airways in the lungs, so it's very useful. IV magnesium is also extremely useful for the prevention and treatment of seizures in women who develop a complication of pregnancy called preeclampsia. So we use IV magnesium in the hospital a lot, and IV calcium as well, right? In an outpatient setting, intravenous magnesium, it's useful for migraine relief, as it can provide rapid relief when given intravenously. There's some evidence indicating that IV magnesium can help manage neuropathic pain after major surgery, major trauma, or burns on a large surface of the body. Now, here's the thing. As magnesium is known to be involved in protein production, in the making and refurbishing of our DNA and RNA, which is the genetic material in our cells, and because magnesium regulates our mood, reduces stress, and influences our hormones, as well as it has an antioxidant effect and can help muscle function, heart health, nerve function, energy production, it makes sense that some magnesium would be useful whenever a restorative IV vitamin therapy plan is made, especially when the client has significant digestive issues that most likely will cause or contribute to a deficient absorption of magnesium. If you're listening, maybe you're wondering, hey, is my body absorbing the magnesium in my food or my supplement? Well, did you know that a high saturated fat diet will significantly reduce your magnesium absorption? So guess what? Those fries, they taste real good, but they're probably really bad for your magnesium levels. Did you know that eating a lot of sugar will increase the rate of elimination of magnesium through your kidneys? Are you aware that the phosphates in carbonated beverages, especially carbonated dark sodas, bind to magnesium, making it unusable by the body? Did you know all these things? So you think, okay, well, I'm taking magnesium supplementation, but I just had a Diet Coke at dinner. Well, that Diet Coke sits in your body, in your stomach and your small intestine for a little while. It's not going away. So don't count on that magnesium to be absorbed. So in conclusion, some of the B vitamins, including B12, as well as the calcium, magnesium, and vitamin C, could, in some circumstances, depending on the medical condition, be covered under your insurance plan. Okay? Now, let's talk about other nutrients and ingredients that are available, which would most likely just be purely available on a cash pay basis and probably be included as part of a restorative health plan when a person is confronted with multiple deficiencies, especially a disruption in their mitochondria may be caused by Lyme or Epstein-Barr or COVID. How about alpha-lipoic acid? Well, this is a compound with antioxidant properties that plays an absolutely vital role in our energy metabolism and also is a cofactor for all the mitochondrial enzymes involved in the production of energy. So we need alpha-lipoic acid, also known as ALA. It is a very potent antioxidant. It protects us from oxidative damage and neutralizes the free radicals in fatty tissues and in water, which is unlike most antioxidants that work either in one or the other. So to recap, we need alpha-lipoic acid for energy, for protection against free radicals, for blood sugar regulation. It helps improve symptoms of neuropathy, specifically and particularly in diabetics. It supports a healthy cognition and could potentially be supportive of improving age-related memory decline. And last but not least, its antioxidant properties are supposed to promote healthier skin and potentially slow down the effects of aging. And again, might look real good and feel real good in a beauty IV. A big category of nutrients available for intravenous therapy are actually amino acids. So let's talk about amino acids for a few minutes. What are amino acids? Well, amino acids are organic compounds that serve as the building blocks of our proteins, and they play a vital role in numerous bodily functions. They are absolutely essential for tissue growth, for energy production, for nutrient absorption, and for immune function. Lysine, let's talk about a few of them. Lysine, it's an amino acid available to be administered intravenously. Lysine is also an essential amino acid, which means it cannot be made by the body and must be obtained from food. Who has not heard that lysine protects them from cold sores or the herpes outbreaks? Everybody. But lysine is much more important than that. It is crucial for the production of proteins and is very important to help tissue repair and regrowth. Lysine is involved in the formation of collagen. Everybody knows that collagen is an essential protein for skin, bones, tendons, and cartilage. So again, lysine supplementation would be great in what we call a beauty IV, right next to vitamin C and a little ALA, alpha-lipoic acid. Another amino acid available for intravenous administration is carnitine. Carnitine is an amino acid product that is produced by our body in the liver and kidneys. Again, it's an amino acid product. Comes from two amino acids, lysine and methionine. There are two main forms for carnitine. L-carnitine, which is the biologically active form that's used by the body, and D-carnitine. Again, who is working out and has not heard of carnitine? L-carnitine is the only one available for IV administration. Now, why do we need carnitine? We need it for energy production. We need it for our fat metabolism. And we need it for heart and brain function. Carnitine can also help remove toxic products generated during fatty acid metabolism. And again, everybody knows this, we need it for exercise performance because it reduces fatigue and reduces muscle damage, and it can help repair our muscle when we mess it up during exercising or over-exercising, right? This amino acid is mainly obtained through dietary sources from animal products. So vegans and vegetarians might have significantly lower levels of carnitine. Carnitine would be a great product in an IV that is meant to support recovery and boost energy and performance in athletes or people that have chronic medical conditions that cause them fatigue. What about glutamine? Well, L-glutamine is a non-essential amino acid. That means the body can produce it on its own. So if the body produces it on its own, then why would we need to supplement? Well, it turns out that in times of stress, in times of illness, or heavy-duty exercise, the body's demand for this amino acid overcomes its ability to produce sufficient amounts. So we will need to supplement L-glutamine. This specific amino acid is a crucial amino acid for protein production. So it will be supporting muscle growth and repair. It is essential for recovery from illness and severe, intense, rigorous exercise. It is very important for our immune function. It contributes to maintaining the acid-base balance in the body. It acts as a precursor for some of our neurotransmitters, especially glutamate and GABA. So it is very important for brain function and mood regulation. But what this amino acid is mostly known for is the fact that this amino acid, L-glutamine, is a major fuel source for the cells lining our intestine. So this specific amino acid is crucial to maintaining the integrity of our gut lining, our gut barrier, and for promoting digestive health. So let's talk about another non-essential amino acids available for intravenous therapy, like proline. Proline helps with collagen formation because it is a key component of collagen. And obviously, we know that collagen is important for skin elasticity, wound healing, and to give strength to our connective tissues, our tendons, our bones, and our cartilage. Proline helps in the repair and regeneration of our tissues, which makes it highly valuable when we recover from injuries, from surgery, or from any stress on our bodies like major trauma. So probably both lysine and proline would look really good in a beauty IV. Last but not least, let's talk about arginine, also known as L-arginine. This is a semi-essential amino acid or a conditionally essential amino acid. What does that mean? Well, the body typically produces enough L-arginine, but there are times, like periods of rapid growth, severe illness, or severe stress, when additional supplementation of arginine will be necessary. You might have heard of the thing that L-arginine is famous for, which is nitric oxide production. L-arginine and another amino acid called L-citrulline, these are the two main precursors to nitric oxide, which is a molecule that helps dilate our blood vessels, improves our circulation, and maintains a healthy blood pressure. Arginine also supports collagen production and other mechanisms that are important for tissue repair and wound healing. But arginine is also very important for our immune cell proliferation and function. It helps our body's ability to fight off infections. Arginine supports protein synthesis and may help muscle growth and recovery, which is making it very popular with athletes and bodybuilders, right? So athletes and bodybuilders and people who exercise and they know their stuff, they love amino acids and they love carnitine. So in conclusion, there are many benefits to IV vitamin therapy. I'm just going to do a quick recap for you here as I'm closing this episode. Number one, enhanced nutrient absorption. Unlike oral supplements, which must pass through the digestive tract, IV vitamin therapy will deliver the nutrients directly into your bloodstream. This ensures 100% bioavailability, making it a very efficient method for replenishing vitamins, minerals, especially when we need it to recover from intense stress, trauma, surgery, or a beauty laser procedure, right? Just remember your medical insurance will not cover any of these circumstances. Number two, improved energy levels. Many individuals report feeling an immediate boost in energy after an IV vitamin therapy session. The infusion of vitamins like B12, known for its energizing properties, can combat fatigue and improve overall vitality. But we just talked about all the amino acids, the carnitine, the arginine, and all these other ingredients that actually boost energy, including vitamin C, right? Number three, immune system support. It's well known that IV vitamin therapy can strengthen the immune system with high doses of vitamin C, B complex, as well as other essential nutrients that I just reviewed. And this can be particularly beneficial during flu season or when recovering from illness, right? Everybody knows now. IV vitamin therapy, it's extremely popular for this specific reason. You're down under the weather, you just came from a major trip, you're going on a major trip, book an IV, and everybody's doing that. Number four, enhanced hydration. Many people do not drink enough fluids, which leads to dehydration. IV vitamin therapy will provide instant hydration, which improves skin health, muscle function, and overall all bodily processes. Number five, improved mental clarity and focus. Certain vitamins like the B vitamins and all the amino acids are known to enhance cognition. A session of IV vitamin therapy can result in improved focus, mental clarity, and overall brain health. And not even to mention NAD and what it can do to foggy brain, right? We talked about that previously. Number six, it will promote faster recovery. Like athletes often use IV vitamin therapy to accelerate recovery after intense physical activity or in preparation for a performance or a competition, because the immediate delivery of nutrients helps repairing muscles and reducing inflammation. Number seven, detoxification. IV therapy can support liver function and help detoxify the body. Ingredients like glutathione are very potent antioxidants that will help remove toxins and remove free radicals, plus the B vitamins, the C vitamins, and everything else. And last but not least, the benefit of IV therapy is you get customized nutrient blends. IV therapy can be tailored to meet individual needs. When someone is seeking a beauty boost, an athletic recovery, stress relief, customizing these infusions can target very specific health goal for that person, okay? Now, IV vitamin therapy is not a replacement for a healthy diet and is not a replacement for your daily vitamin intake, but it does offer numerous benefits for those seeking an efficient, customizable approach to nutrient replenishment and wellness. And whether it's for energy enhancement, for immune support, for improved hydration, or for beauty, this therapy might just be the health boost and the beauty boost you need. So come back next week to listen to my next episode, in which I will discuss insurance coverage of IV vitamins and other restorative therapies as well. Please, I invite you back. That is a very interesting episode. As a matter of fact, I believe I'm splitting that in 2 episodes because it's pretty long and I have a lot to say. So I welcome you next week. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas. So please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.